Thank you. Thank you so much. Thank you. It's just great to be here today. Steve Jobs, Kobe Bryant, prodigies, tremendous potential at a young age, amazing accomplishments at a young age, and tremendous fulfillment of their potential as they grew, as they developed, as they matured. Each one of them did far more than anyone would have thought would have been possible. Steve Jobs in business, Kobe Bryant in basketball. In business, Steve Jobs took his company public when he was 25 years old. The largest public offering since Ford Motor Company became public in 1956. Not sure what you were thinking about when you were 25, but I certainly wasn't thinking about taking a company public. The day the company went public, 300 people became millionaires. Over the years was the CEO of another company, Pixar, got thrown out of Apple, came back into Apple when it was almost bankrupt, created the most valuable company on planet Earth with iMacs and iPads and iPods and I don't know what else. An amazing accomplishment in the world of business. Kobe Bryant, drafted right out of high school, never went to college, played for the Lakers, was the youngest person when he stepped on the NBA court, the youngest person to ever play in an NBA game. When he signed with the Lakers, he was 17 years old. He literally couldn't sign with the Lakers for a multi-million-dollar contract his parents needed to sign for him. He's won 5 NBA rings. He's been an all-star 12 times. He's played in 14,000 games. He has an Olympic gold medal and sets all kinds of records as the youngest ever to do X, Y, or Z early in his career, and now he's setting records as one of the oldest players to accomplish all sorts of things. Students of business, students of basketball will be studying their lives, studying their decisions for years and decades to come, because we all have a lot to learn from how they conducted their affairs and what they were able to accomplish. But we're not here today to talk about that. As important as it is, I think we're here today to talk about something that's actually much more important. They both made extremely important healthcare decisions, and I think we can all learn as much about their healthcare decision-making as their business and basketball decision-making. So what I'm here today to talk to you about, and I'm delighted you're here to participate, is really what Steve Jobs and Kobe Bryant can teach you about your healthcare. One got it right, and we all know one got it tragically wrong. So let's start with what went wrong. Steve Jobs' biggest, most important decision was his biggest mistake. It started in October 2003. He was symptomatic. He had pain in his gut. He went in to have it diagnosed. He had some imaging done, and it turned out that he had kidney stones. And while they were doing the imaging on the kidney stones, they found a suspicious shadow on his pancreas. They biopsied it. They realized he had pancreatic cancer. That's what we call in medicine an incidental finding. It's the discovery of something, frequently a cancer, while you're looking for something else. Anybody who knows about pancreatic cancer knows that it's a very frightening diagnosis. He was very fortunate, however, because it turns out that there are 2 types of pancreatic cancer. There's the neuroendocrine kind that he had, which is a very small portion of the pancreatic cancers, and what's called an adenocarcinoma, which represents about 95 to 98% of the pancreatic cancers. So he was very fortunate in 2 ways, because the kind of pancreatic cancer he had was potentially curable. People diagnosed with that typically do quite well, and he had the potential to do quite well. The treatment that was recommended was very simple and very direct. Every single physician recommended surgery. His board of directors told him, Steve, you got to have surgery. You have to have this thing removed. Every doctor he went to told him, we need to surgically remove it. But Jobs, if anything, was a contrarian. He followed his own drummer. He did what he wanted to do, and he created an enormous amount of value by cutting against the grain. This time, what he decided to do was eat organic herbs, to do hydrotherapy, to follow shaman, to do a variety of totally unproven things. For 9 months, he refused surgery. For 9 months, he had juice fasts. He did things like expressing negative feelings. So by July 2004, 9 months later, when they did the next imaging, they found that the cancer had grown. Not only the lesion in the pancreas gotten bigger, but they found suspicious shadows in the liver. Never a good sign with cancer, certainly not a good sign with pancreatic cancer. So he finally decided to do surgery. When the surgeon went in, they cut out everything they could, but they saw they had lesions in the liver, and they knew they had an enduring problem, and they knew that over time, the problem was going to win, and they weren't. Jobs engaged in a variety of different chemotherapeutic treatments. He ended up going to Europe to try some innovative things he couldn't find in the US, but the die was cast, and it was just getting more difficult. Finally, in January of 2009, he was too sick to continue to work, and this is a guy who worked 7 days a week, 20 hours a day. His work was his life, and he was so dedicated to it. So you can imagine how compromised he felt when he could no longer lead the company that he had founded and returned to. In March of that year, he's an effective guy. He knows how to pick up a phone. He can spool up his jet. He can get people to respond to him. Money's not an object. So by March of that year, he was able to get himself a liver transplant. Got him some more runway. Got him some more time. But it didn't defeat the problem. By a year later, December 2010, he weighed in at about 110 pounds on a big lanky frame. We all remember seeing those photos. The clothes were just hanging off of him. There was nothing left. He had no weight left. He couldn't extract nutrition from the food that he was eating. It was quite scary to see a guy who had been so robust and so dynamic to be so depleted. And then later in 2011, a year later, he kind of acknowledged, and it was a very interesting point, and here's one of the lessons. If there's any one lesson that Steve Jobs can teach us, I think it's right here. He realized that he was facing the type of problem he never permitted at Apple. His treatment had become fragmented, and that was one of his problems. So finally, sadly, in August 2011, he had to resign from Apple to take care of himself, and just a couple months later, in October 2011, he passed away quietly with his family and closest friends around him at his home in Palo Alto. So that candle, that flame, that spark, that inspiration, that was Steve Jobs, that created not only the most valuable, but really one of the most transformational and interesting companies that we've ever had been extinguished because its founder, its CEO, its guide, its inspiration made a terrible mistake on the most important decision of his life. So let's slip over now to a happier story, Kobe. Kobe Bryant, as you know, started to play basketball, the NBA. He was 17 years old. Here's a chart that shows his productivity. An incredibly creative and effective scorer, most difficult person to defend in the league. One of the most accomplished basketball players who played the most minutes in the most games and is basically a workhorse. By 2012, after he'd been in the league for, I think, 14 years, he was on the All-Star team as well as on the Olympics. And if you look at the average age of the players who played with him, the average age was 25, he was 34, and he was better than almost any of them. The only people that could compete with Kobe Bryant at age 34 were 7 or 8 years younger than he was. But at the end of the 2012 season, having played in 1,400 games with about 4,500 minutes of brutal NBA action in the regular season and about 54,000 minutes, including the postseason, he was worn down. He could barely walk off the court. This shows the pain that this incredible competitor was in. And if you look at what it was, this is a picture of a healthy knee with the cartilage and bone. Even a fifth grader would be able to look at that and tell you that's a picture of health because everything is balanced, it's rounded, it's fitting together, it's working well. And although we've not seen publicly the images of Kobe's knee, based on what's been described, they kind of look like this. There were bone fragments. The cartilage had been worn away just from wear and tear, even for an athlete who prided himself in how he took care of himself. So his knee was in bad shape, and he had a variety of different choices. None of them were really easy. Choice one was an arthroscopic repair where they put in, through tiny incisions, a variety of instruments to fix up the various pieces in the knee. Pretty invasive, requires a lot of recovery. Second choice was a total joint replacement. Would have been the end of his career. Third choice, plasma-rich protein, which is a technology in which they take some of the healing components of the blood and inject it back into the joint. A fourth was injections of something called hyaluronic acid. Hyaluronic acid tends to be very therapeutic when you've got cartilage and other kinds of problems, and Kobe had the option of doing that. The last choice was sort of the most novel one. It was a technology called Regenikine, developed by a physician scientist in Germany by the name of Peter Wehrling. It's only available in Germany and a couple places in the United States. Kobe decided he was going to use Regenikine. Turned out, it's a brilliant choice. So what's Regenikine? Very interesting technology. It's a 5-step process. The first up, they just draw some blood, just the way we've all given blood. No big deal, a couple of vials of blood. They then take that blood and they store it overnight, or for 2 days, in an autoclave at about 102 degrees with these tiny glass sintered beads. They're rough around the edges. So what they do with the autoclave and the temperature in the beads is fool the blood into thinking that it's fighting an infection. The beads replicate a bacteria or a fungus or other kind of infection, and the heat in the autoclave mimics the fever that you'd have if you had the cold or the flu. Exposed to those stimuli, what the blood does is it develops these things that are called heat shock proteins, which are the most therapeutic substances Mother Nature has ever developed. Every living thing, from the smallest E. coli to plants to humans to animals to whales, all generate heat shock proteins, and they're all actually quite similar in structure. And what that tells you is Mother Nature knows that she figured it out. They're the most therapeutic and healing of all proteins in all of nature. So what they next do is they spin the blood to isolate the plasma. They then concentrate the heat shock proteins out of it, and then with a simple other injection, inject it back into the injured knee, the shoulder, the elbow, whatever it might be. And they typically do a couple of injections over time. So after the 2012 NBA season, Kobe had that done, and he bounced back in 2013 until the very end of the season, was the leader in scoring in the entire league. The only people who could compete with him again were people that were 7 or 8 years younger than him. So Kobe Bryant made the right decision. Sadly, Steve Jobs made the wrong decision. What I'm here today to talk to you about is to help you understand the key healthcare decisions and for you to make the right decisions for yourselves, for your families, for your friends, for your colleagues, for your neighbors, for your employees. Because if there's anything that I have learned, it's that when you know how to navigate this very troubled healthcare system of ours, you can get far better outcomes than you think possible. But if you simply take the care that the system gives you without being an active agent, without being a good consumer, the outcomes you're going to get are actually much worse than you think. So there's 10 things. It's really not a lot. So let me go through the 10 things that you can do to protect your health, beginning right here, right now. First, most important, forge a strong, personal, enduring relationship with a top primary care physician. I don't know what's going to happen to you when you leave, when you drive out of here. I don't know if you're going to twist your ankle on the street. I don't know if there's a cell that's going to divide improperly in your body tomorrow and you're going to have cancer. I don't know if you're going to develop an autoimmune condition next year. I simply don't know, and neither do you. But there is one thing I know, and that's you need a very strong relationship with a primary care physician, basically because we don't know what's going to happen to your health, but we do know that a day will come when something will happen. And you need to find somebody that you trust. Why is that? They're busy people because of the reimbursement challenges. They manage between 2,000 and 4,000 patients every year. They see 25 to 40 patients a day. Appointments that used to last a half hour or 40 minutes are now 10 to 15 minutes. Very difficult to care in that period of time. When they have active practices, they have to coordinate with over 200 physicians in different specialists, in different specialties, and do that without software systems. Nobody else in our society is asked to do that. And it turns out, if you really look at the data, about 7% of the clinically important findings, that is to say you've got a problem, get lost in the system. They fall through the gaps. And you as a patient don't even learn that you have a problem. And finally, medical errors, it turns out, in the United States of America, with the finest healthcare the world has ever seen, medical errors represent the third leading cause of death. If you include all the diagnostic errors, the medication mistakes, the surgeries that shouldn't have happened, the surgeries that were done by people who shouldn't have been doing them, the missed diagnoses, the failures of communication, we lose about 225,000 Americans every year due to medical errors. And one of the key ways that those errors occur is because of poor communication. The system's too fragmented. So what you need to do, and I would encourage you to do it if you haven't done it already, find a good primary care physician, someone you trust, someone who's going to be your quarterback, someone who's going to coordinate the care for you, and someone who's going to be there when you need them, because even if you don't need them today, that day is going to come tomorrow, and you will. So, second thing I would tell you is organize your medical records. Collect them. You know, we all have ATM cards in our wallets, right? We can take that card in any city, any town in the country, frankly, any city in the world, and even villages in China, okay? You could put that card in a machine and get $100 of local currency instantaneously, because the whole banking system is connected. Not so in healthcare. It's very difficult to get your medical records across town from UCLA to Cedars, from New York Presbyterian to Mount Sinai. The hospital record systems don't communicate with each other. If you have a physician that's not in that hospital system, they aren't going to have access. So physicians end up being the only respected professionals in our society who are asked to and are compelled to provide services on incomplete information. You can prevent that from being a problem. Here's what I do. Here's what we do in our practice. Every one of our patients has their medical records collected. By the way, they belong to you as a matter of law. All you need to do is fill out a form, send it into the doctor's office, and they're legally obligated to send them to you. You own those records every bit as much as you own your suit when you send it to the dry cleaner and you park your car in a parking lot. That's your car, that's your suit, those are your medical records. So you can get them organized, you can digitize them, running them through a scanner, and then you can put them on a card like this, which I have in my wallet. You can buy them online for $10. It's got a USB port that opens and closes. It fits right where all my other credit cards are. And anytime I have a medical appointment and they start with the questions, you know those questions? What medications are you on? What was your diagnosis? When have you had surgery? I can't remember all of that. None of us can remember all of that. Why would you trust your memory anyway? Why not have it in your wallet? I take my card out, I open it up, we put it into a computer, we print out my entire medical records, and every time the physician I'm seeing says, do you have any idea how much easier it would be for me to provide quality of care if every one of my patients had that? So collect, organize, digitize your medical records. Do it for your spouse. Do it for your kids. We're all concerned about the safety and security of our families and ourselves. Organizing and having your medical records is a simple and direct way to ensure that happens. Third thing, if you have a major problem, go to a major academic medical center. Think about it. It's just like so many other realms of life. If you wanted to learn about an aspect of mathematics, and it was addition, subtraction, multiplication, you understand that you can get that done in a local public school. If you wanted to learn about more advanced topics, you'd need to go to a college. And if what you were interested in was theoretical physics, which none of us can understand, you'd need to be at a university with a department with theoretical physics. It's the same thing in medicine. I'm a great believer in the power of small community hospitals, but they should not be doing the most sophisticated medical procedures because they would only do them occasionally. So think about the way in which the healthcare system should be organized in which those institutions at the highest level in the system are doing the most complex and dangerous procedures and guide your care to those institutions. So here's some data, somewhat troubling, but it's all real. This shows the incremental risk of mortality for some significant procedures when they're done in a small community hospital that does them infrequently versus a large academic tertiary or quaternary care treatment center, a big hospital that does them all the time. For coronary artery bypass surgery, 18% incremental risk of dying merely because you picked the wrong place. For abdominal aortic aneurysm repair, 20%, about the same. Coronary angioplasty, 45% incremental risk, 43%. Cerebral aneurysm, about 1.5 times the risk. And then you look at pancreatic surgery and esophageal cancer surgery. These are major complicated procedures that should only be done by people who do them all the time. You've got a 2.5 times incremental risk of going out the back door, sadly, as opposed to being wheeled out healthy in the front door. Make decisions about the hospitals you go to based on the complexity of the procedure you need and the frequency with which they do it. When you need a specialist, go to the best. Think about how you've selected physicians in the past. It's mysterious, human nature. I really don't understand a lot of it. I don't pretend to. But one of the mysteries that I always wonder about is how people decide the degree of research and analysis to do in making a decision. We're really careful at buying a car. You test drive it. You get car magazines. You go to websites. You go to Yelp to figure out whether this restaurant's going to be good. TripAdvisor to figure out where to stay at a hotel. There's all this work that people do to figure out how to get the best of something. If you got a gadget with a part number, you go on Amazon, you read the reviews. There's so much information about it. But when it comes to selecting physicians, we act on it very, very differently. It's not atypical. This is a bit hyperbolic. But, if you need a specialist for a dermatologic issue and you're with your hairdresser and you're discussing it with him or her, and they'll say to you, my cousin's brother's uncle's friend's daughter's babysitter's friend had a similar procedure, went to Dr. Smith and got a good outcome. Too chaotic, too chaotic. It's one of the most important decisions you can make. You need to figure out a process to identify a specialist who's at the best in the game. And I'll tell you that in many cases, the key predictor of excellence in surgical performance is volume. We're all familiar with the 10,000-hour test. We all know that people focus on specific things and get them done, learn how to do them better. Let me give you some data that'll open your eyes to see how important this can be for you. Let's take prostate cancer surgery and look at, this was a big study that was done of thousands of prostate cancer surgeons who had done surgeries over a 7-year period and looked at the recurrence of disease after the surgery based on how many surgeries that physician had done before. So if you take those physicians who had done less than 50, we'll all agree those are rookies, about 24% of those patients, regardless of how they came in, had a return of the disease. Big number, 1 in 4. If you take the people that had a little more experience, who'd done 50 to 100 of them, you're down to about 18%. Pretty big reduction just in that little bit of volume. Then you look at those who'd done more than 100, up to 1,000. It plateaus at about 13%. So right there, by going to somebody who's done more than 100 procedures, you've taken the likelihood of return of disease and basically cut it in half. But you got to go further. Let's look at the docs who've done more than 1,000. The return of disease is 8%. So merely by asking a surgeon and getting a truthful answer, how many of these have you done, ma'am? How many of these have you done, sir? And setting a threshold of 1,000 incidents of doing it, you can reduce your probability of having the disease come back and, frankly, of dying from it threefold, having nothing to do with how the disease came in. And then you go to the people who are really at the top of the game. The surgery team at Memorial Sloan Kettering in Manhattan, top of the game in surgical interventions for prostate cancer, and their published data is 7.2%. So if you have a major problem, go to a major institution. If you need a specialist, go to someone who's at the top of the game. There is no time better invested than in finding someone who's at the top of the game. Fifth point, be at the cutting edge, not the bleeding edge. I know a lot of you are sort of early adopters of electronic gadgetry. You know the difference between the cutting edge and the bleeding edge. It's a pretty big difference, and it's a really big problem in medicine. Perhaps the biggest example is what went on some years ago, in which there was a treatment developed for postmenopausal women called hormone replacement therapy, which was a high-dose hormone replacement therapy. And for you guys in the audience, you may not understand this, and I just invite your women to lean over and explain it to you. They understand it entirely, like so many other things, frankly. But there was a technology, a drug regimen called high-dose hormone replacement therapy that was almost universally recommended for women who were menopausal or postmenopausal to address the troublesome symptoms of menopause, as well as reduce the risk of cardiovascular disease and osteoporosis. And virtually all the physicians I knew, whether they were early adopters or more cautious, all embraced this approach to treatment. It seemed to make sense. So women every place were put on this treatment prior to the major trial studying its efficacy being wound up and evaluated. So the study that was done to test it was a huge study. It's called the Women's Health Initiative. 160,000 women participated. It was begun in 1991, and it was stopped on a celebrated day, May 21st, 2002, a decade later, because the early results came back, and they were quite troubling. So remember here, stay with me on this, because I'm going to give you a lot of data. Remember here, the goals of the trial were to reduce symptoms, reduce risk of cardiovascular disease, and reduce osteoporosis. So when the reason that they stopped the study is because they saw an interim cut of the data. It was a study designed to reduce cardiovascular risk. Cardiovascular risk actually went up 29%. It was a study that was designed to reduce cancer risk. Breast cancers went up 26%. Hold that number for a moment, because I want to tell you just how troubling this was. Stroke incidence went up 41%. Okay? All cancers went up 3%, and fractures, the one benefit that came from the trial, was a 24% reduction in fractures, which was the benefit. It was decided universally that that drug intervention was just too risky. It was pulled off the market and fortunately has been replaced with a much lower dose hormone replacement therapy that's much safer. But look at that breast cancer number, 26%. Do you remember 10, 15 years ago? It seemed that every woman was getting diagnosed with breast cancer. You'd open up the newspaper, there's another high-level woman diagnosed with breast cancer. It seemed to be pandemic. What was going on? Actually, sadly, tragically, a lot of that breast cancer was a direct result of this treatment. And here's how I'll prove it to you. These are data that will show you the rate of breast cancers per 100,000 women for a 20-year period, a 30-year period, from 1975 to 2005. The incidence of breast cancer on a relative basis for women under the age of 50 is as flat a line as you'd ever imagine in any time series of data. There was no change. That's as flat as a table. But if you look at the incidence of breast cancer in women over 50, before hormone replacement came in, it was basically pretty flat. Hormone replacement therapy kicked in the late 80s and early 90s, and look at that dramatic incidence in the per capita population. It went from about 250 per 100,000 to almost 400 per 100,000, a huge increase. It was about that time that the preliminary results became available and people started to pull back from using it. And look at this, the incidence got back down. We don't have current data yet, but I'll bet everything I own, because I'm sure I'm right, that we're going to get it back down to about 250. So the point of this is even when the medical profession has got both hands around and is embracing a new intervention, be cautious. The data are always more interesting and more important and more persuasive than the anecdotes. Next point. We as Americans tend to want interventions. We like to go to the doctor with a set of symptoms, walk out with a prescription or surgery, and be healed. There's this tremendous bias in our system toward treatment. Everybody thinks that they want more treatment. I want to caution you. Be as careful about overtreatment as you are about undertreatment. It's frankly a bigger problem. And look at this. This is some data I'll show you about angiography. Angiography is a diagnostic test in which they image the arteries in the heart to see whether they're blocked or not. And the results of the angiography exam would tell you whether you need to go in with open heart surgery or some other intervention to open up those arteries. And the extent to which the arteries are blocked is a very important determination as to whether it makes sense to go in and change them. So the interpretation of the angiography is extremely important. So what this study did is it took thousands and thousands of angiographies and it had them independently evaluated by a panel of experts looking at the significance of the disease, the severity of the blockage, and the extent of the disease, the three parameters that would determine whether it makes sense to have a surgical intervention. So when the panel of experts looked at the disease significance, 16% were actually better than they had been rated, 4% worse, an aggregate 20% difference. If you look at the severity of the blockage, 6% were actually worse than they had been rated, and 43% were actually better, almost a 50% difference. And if you look at the extent of disease, 16% worse and 23% were better, so that's about 39, almost 40% difference. When you tumble all that together to make a judgment as to whether it makes sense to have the surgery, and they saw which patients had the surgery and which didn't, right? It turned out that 33% of those who had bypass surgery didn't need it, and 25% of those who needed it didn't get it. It sounds a bit acidic, it sounds a bit callous to say it, but in some places it was almost like tossing a coin to see whether the patient should get it. So for you, as a consumer, as a patient, I'd invite you to be in neutral and be at least as cautious about overtreatment as you might be about undertreatment. Next point. It's really weird, in my experience, the way people become healthcare consumers. If Americans are good at anything, we are really good at being consumers. When the Japanese and the Germans were making better cars, we crushed Detroit. When BlackBerry came out with their gadget, we loved it. They were ascendant, everybody were we were BlackBerry addicts, right? And then when Apple came out with a better phone, everybody migrated there and crushed BlackBerry. And I could give you 1,000 examples like that. But when it comes to healthcare, we treat healthcare decisions differently. And what I'm in front of you to talk about is to learn from what Steve Jobs did, to learn from what Kobe Bryant did, and just become a better healthcare consumer. To, rather than shut down those instincts, those reactions you have to things that are right or wrong, to become more engaged in the process. And I know it's difficult. The physicians speak in jargon, hard to penetrate. You're anxious. You've been kept waiting for a half hour, 45 minutes. You're in the exam room, in your skivvies, with this gown with your butt hanging out. It's cold. You got magazines that are 6 and 8 months old that you wouldn't even read if they were fresh. It's a very awkward environment. But regardless of that, there's an enormous benefit from you from doing the kind of research that you would do if you're going on a trip, if you're going to a restaurant. Question questionable claims. Trust your instincts. Doctors are physicians. They want you to engage with them to figure out what the best path is. Get different perspectives. You get different perspectives when you want to have your bathroom renovated, when you want to have the landscaping redone. You bring in different people to get different ideas, but for some reason that I don't quite understand, people are afraid to do that with your physicians. I'd encourage you to get over that fear. Your physicians want you to be an active participant in the care process. Ask questions. Get different perspectives. Trust your instincts. You know, as we get older, we all have sort of considerable guts, and that's for a reason, because they're going to tell you when something's wrong. So if your instinct is that there's a problem here, even if you can't understand why, just as you would act on that in other environments, I'd encourage you to act on that in healthcare as well. And work on forging your physicians into a single team. All too often, physicians tend to operate in silos in an isolated fashion. It's not their fault. They're doing the best they can in a system that's not very supportive. What you need to do with a primary care physician, but you need to be the person who does it, is work hard to forge all those physicians into a single team. It's your body. It's your life. It's your opportunity to get fulfillment. It's your opportunity to live a long life. And you may have some pain in your knee, and you may have a scar on your elbow that's hurting you, and you may have some digestive systems, and your back might hurt. You might have some fatigue, and they all might be treated by different physicians, but they all might be linked to the same thing. And the treatment for one might aggravate the condition for another. It's your responsibility, your obligation to synthesize that and make sure that your doctors are talking to one another about you and with you. Collect medical records. Talk to your physicians. Make sure they understand the other physicians you're seeing, the other complaints you have. You'll get a holistic response that will not only be much more satisfying, it will reduce your anxiety, and frankly, it'll help you live longer. A couple more points. Lead a healthy lifestyle. Sounds pretty banal, doesn't it? Sounds pretty complex. Leading a healthy lifestyle is sort of taking on a life of its own. It's actually far simpler than almost anybody thinks and far more impactful. 4 points. 1, don't smoke. You know that. If you smoke and you care about your future, it's simple. Figure out a way to stop. I don't know how to be more clean or specific about it. Avoid excess weight. We all know that carrying around too much weight can be dangerous medically. Be physically active. The human body was made to move. It wasn't made to sit, okay? Be active. Activity offers so many benefits, and eat a healthy diet. It's 4 points. Don't smoke, avoid excess weight, be physically active, and eat a healthy diet. I would submit to you that we have challenges in life. This one takes a minute to get, right? But you got people that are paying money to go to 24-hour fitness and get on Stairmasters that are taking the escalator to get there. Sometimes I don't understand the United States of America. It gets worse. You can't make this up. I promise you this isn't photoshopped, okay? This is the way life is in America. We are full of temptations. It requires enormous willpower, frankly, times much more than I have, to resist these kinds of temptations. But if you're able to follow just those 4 things I talked about, it's much simpler. The benefits are much greater than anybody in this audience is thinking right now. Big study, 23,000 patients with 8 years of follow-up. That's a big trial. Results reported in 2009. Let's look at the reduction in risk for heart attack. 81% reduction in risk in heart attack for people who don't smoke, who exercise regularly, maintain a proper weight, and eat a healthy diet. 81% reduction in heart attacks. There's no medication, there's no treatment in the world that has any benefit remotely approaching that. 71% reduction in diabetes, 50% reduction in stroke, 36% reduction in cancer. We're all scared, properly, of every one of those diagnoses. But I am telling you, if you follow those 4 simple rules, you will dramatically reduce your probability of having them. Let's get to diet. On Amazon, I think there are 150,000 different diet books. There's every diet that you can imagine, and thousands and tens of thousands that you can't even imagine, where people make a lot of money promoting the books. Turns out very few of them work, which is why people then buy the next book. But there actually is a dietary approach that has profound benefits. It's the Mediterranean diet. You've heard of it. It's not really a diet. It's sort of a shifting of the palate to eating somewhat different foods that actually work much better from a health perspective. It's very simple. Let me tell you what it is. It's about 9 different things. First, drink red wine. Anybody in for that? I prefer Pinot, sometimes a good Cab, but you're encouraged to drink red wine. Obviously, not in a situation in which there's an addictive issue, and in certain kinds of circumstances you shouldn't be doing it, but there is medical benefit that comes from drinking red wine. Eat less red meat. Turns out red meat is very damaging to the cardiovascular system. And the numbers and the percentages here show the percentage benefit that comes from eating along this palate. It's been quantified. It really works. So it's more red wine, less red meat. Eat fruits, eat vegetables, okay? Eat lots of different vegetables. They're colorful, they're flavorful, and they actually have tremendous phytonutrients and other things that substantially increase your health. Eat fruits and nuts, okay? Significant benefit that comes from it. You're hungry in the afternoon, don't go for the candy bar. Eat several dozen or a dozen almonds. You'll find in 10 or 15 minutes that that hunger you have is actually reduced, and you'll feel better from doing it. Olive oil. There's a lot of different oils. You go to the grocery store, there's dozens of different kinds of oils. What the data have shown is actually olive oil is beneficial to you. So if you go into the Michelson household, the only oil you're going to see in our kitchen ever is olive oil because it has health benefits. Next item is eat legumes, eat beans. You know, Americans typically don't do that. They feel like they're a little bit awkward. Go find them, eat them. They're very helpful. And last but not least, two other things, I'm sorry. One is dairy products. In the Mediterranean diet, because they don't have the level of cattle that we do, so they don't have as much dairy, cut down on the cheeses, cut down on the fatty milks because those result in cardiovascular risk. And lastly, eat whole grains, and finally, fish. You need more protein in your diet. It turns out that fish is far more beneficial. So it's about 9 different things. You don't need to be extreme about it. If you just try and start to shift your diet from the things you're doing now in this direction, the benefits will be profound and enduring. So what are they? Huge trials here, 12 studies, 3 to 18 years of follow-up. That's a lot. 1.5 million subjects in 7 different countries. This is what's called a meta-study, in which all the various studies of the Mediterranean diet have been aggregated and integrated. So let's look at the benefit that comes from that. Let's look at the percentage reduction, not only in the incidence of disease, but more importantly in mortality. That's the ultimate outcome, right? Let's look at that for several different diseases. And the difference is, what we're talking about is for each additional 2 points of compliance, which is a technical term, but it's the more compliant that you are with the Mediterranean diet, the benefit that you get from doing that. 6% reduction in cancer, 9% reduction in cardiovascular disease, 13% in Parkinson's and Alzheimer's, and overall mortality, a 9% reduction in mortality merely by shifting your diet in that direction. So when we talk about a healthy lifestyle, there's a lot of people who've made that complicated. There's a lot of people who've made a lot of money for making it complicated. I'm not about that. What I'm about is keeping you alive, and in order to keep you alive, it actually becomes very simple. A couple of other points. These will be a little novel. Turns out it's important to be part of a healthy community. We all know from when school starts, the first thing the kids learn how to share are colds, right? We all know in flu season that if you're around somebody who's coughing and sneezing, your likelihood of getting the flu gets worse. So we all know that infectious disorders are communicable through a community. Well, it turns out that health conditions that are not infectious disorders also tend to be highly communicable through a community. It turns out that what your family and friends and neighbors do as a lifestyle influences what you do. I'll give you some data on it. It's quite interesting. Let's look at obesity, biggest health risk in the country today. We all know that the costs of obesity have now eclipsed those of smoking. The mortality as a result of obesity is eclipsing that of even smoking. So let's look at the spread of obesity in a large social network. And it turns out that who you spend time with and the degree to which they're obese is going to influence the weight that you have as well. So if you look at a mutual friend, someone who regards you as a friend and you regard as a friend, if they're obese, you've got almost a 200% likelihood of being obese. If it's a same-sex friend, it's about 50 to 60%. If your spouse is obese, you got about a 50% probability of also being obese. Sibling about the same, and neighbor a little bit. A neighbor who lives next door to you might influence the degree to which you're overweight. So what are the implications of this? Twofold. If you're struggling to lose some weight, if you're struggling to stop smoking or drinking or getting more exercise, shift who you're hanging around with to people who have the weight that you aspire to get, to people who are not smoking, to people who are not drinking, and it will change your life. The other thing is, and I know a lot of you are leaders in your communities, why not exercise leadership here? Take it on. Stop smoking. Exercise more. Change your diet. Lose weight. And what you'll find is not only will you feel better, not only will you be healthier, not only will you live longer, but the people around you will benefit from your change as well. Last point, just in case it might promote a longer life, have a healthy mindset. The data on this are not as compelling as some of the data I can deduce in more scientific studies, but one of my favorite studies of all time demonstrates this in a very clever way. So what do I mean by a healthy mindset? I mean be optimistic. Avoid unremitting stress. It's really two dimensions. We know people who let the small things slide off of them, and we know people for whom even the most minor problem is a catastrophe, right? And as I'm saying this, you can think of people in each category. And we all know people who are stressed all the time. Stress is important, but what's devastating is unremitting stress. It's the consistency of the stress that's damaging to you, but it's the intermittent stress that enables you to grow and change and evolve and find out new things about yourself that can ultimately improve your health. So there's things about your mindset, your attitude about life that result in how long a life you're going to have. One of my favorite, and you can't count the number of studies that I've read and studied over the years, but one of my favorite is this trial. It's a 30-year study of 180 nuns at the School Sisters of Notre Dame. And when you think about nuns in a convent, it is a perfect natural experiment. They wear the same clothes, they eat the same food, they live in the same place, they have the exact same lifestyle. So it creates a really interesting environment in which to study things that are different about people. And the School Sisters of Notre Dame have a tradition in which they write diaries every day about what they're thinking and what they're feeling. So this study, which was so creative, took the writings, the diaries of these nuns from their 20s and evaluated them based on how optimistic or pessimistic they were about the future, whether they sweated the small things or whether they really knew that, it was all going to work out, because frankly, it usually does work out. And they correlated how optimistic they were in their diaries with how long they lived. Really simple study. The results are extraordinary. For those who were least positive, this shows the percentage of them that were alive at a particular age. Those who were the least positive. Those who were slightly more positive, basically the same line. Then you got to those who had diaries that were more positive, and finally those who had the most positive. So it turns out that if you look at a measure of your attitude about whether the future is going to be better or not, those who believed that the future was going to be better, those who didn't sweat the agony of life as much as others, ended up living longer, and by a wide margin. So those who had the most positive attitude in their 20s were 2.5 times more likely to live longer. So if you can get your head around that, if you can figure out how to believe what really is the objective truth, that tomorrow likely is going to be better than today, and that things will work out, you're going to get an opportunity to have more and more tomorrows. So let's just summarize it quickly. 10 things. First, foremost, forge a strong and enduring relationship with a top primary care physician. That's the person who needs to be the quarterback for your health. Go out, collect your medical records, digitize them, organize them, put them on a card, have it in your wallet. You're going to need that One day, I promise you, it will make a big difference for you. If you have a major problem, go to a major academic medical center where they've got the expertise to do it. When you need a specialist, use your skill set to get the very best. Do not compromise. Go to somebody with the exact expertise that you need. Be at the cutting edge. Be very cautious of things that are at the bleeding edge because they can be counterproductive, because Mother Nature is always one order of magnitude more complex than we think. Be as cautious of overtreatment as you are of undertreatment. It's not necessarily better to get that pill. It's not necessarily better to get that surgery. Use the skills that have made you a success in life when you're dealing with your health care. You're all really good consumers or you wouldn't be in this room. Don't shut down your consumer skills merely because you're in your skivvies, in this little gown, in a cold exam room, reading 9-month-old magazines and scared. That's the time to become a better consumer, not a less good consumer. Lead a healthy lifestyle, 4 things, simple and focused, and finally, be part of a healthy community, and last but not least, just in case it can make a difference, see if you can enjoy the benefits of a healthy mindset. You've been a terrific audience. I thank you so much. I look forward to taking some questions. Thank you.